PCOS affects millions of women, but many aren't even aware they have it, with many cases left undiagnosed. Hello everyone, welcome to G's Health channel, where we share practical information about health. Without wasting much of your time, let's dive into today's topic, PCOS. Polycystic ovarian syndrome, PCOS, is one of the leading causes of infertility. In this video, we'll explore what causes PCOS, the symptom, and how it affects your hormone. So let's dive in. PCOS is a hormonal disorder where the ovary produces excess androgens, especially testosterone. Androgens are a group of male cells hormones that are responsible for matrix and reproductive activity, but women produces them also in smaller quantity. Why those with PCOS have higher level of these androgens? The excess androgens interferes with the development and release of eggs. It interferes with ovulation, often resulting in irregular or absent menstrual period. The ovaries may develop multiple of small fluid-filled sac or cysts, but not all women with PCOS have these cysts. The root of PCOS lies in hormonal imbalance. Women with PCOS often have high luteinizing hormone, low follicle stimulating hormone, elevated insulin level leading to insulin resistance, increased androgens like testosterone. This hormonal chaos affects the menstrual cycle. It affects your hair, it affects your skin, it affects your mood, it even affects your weight. Symptoms of PCOS can vary from person to person, but the most common symptoms include irregular or missed periods, weight gain, especially around the belly, skin acne or oily skin, hair thinning or hair loss, facial hair, mood swing or depression, in most cases, infertility. Not all symptoms appear at once, and many women can go years without diagnosis. Why the exact cause of PCOS isn't fully understood. Three major factors can contribute to its causes. Number one factor includes genetics. If your mother or sister has PCOS, you might be predisposed to it. Number two, insulin resistance. High level of insulin can trigger the ovaries to produce more androgens. And number three factor is chronic inflammation. Chronic inflammation can worsen hormonal imbalance. Lifestyle or diet plays a big role in how PCOS develops in your body. How does PCOS affect ovulation and fertility? Normally, each month, an egg is released during ovulation. But in PCOS, hormonal imbalance prevents this process. Eggs may not mature properly or may be stuck inside the ovaries. This is the reason why women with PCOS may have irregular period or struggle with conception. But the good news is, fertility can often be restored through lifestyle and treatment. PCOS can be managed effectively through natural approaches. To manage PCOS, the first approach is to change your diet. Focus on whole foods, high fiber, low sugar, and anti-inflammatory meals. The second approach is to get enough sleep and reduce stress. Poor sleep and stress can high your cortisol, and these can worsen symptoms. For number three approach includes supplements like magnesium, omega-3 fatty acid, vitamin D3, inositol in your diet. This may support hormonal imbalance. For number four approach, exercise. The effect of exercise to our body cannot be overemphasized. Exercise increases the body's sensitivity to insulin. This helps to lower insulin level and blood sugar level. It also helps to regulate body weight. If you have missed period for months, excessive hair growth, especially around the facial area, unexplained weight gain, or can't conceive after a year of trying, blood tests and ultrasounds can confirm PCOS. Early diagnosis helps to prevent long-term risks like diabetes, heart disease, and infertility. If you have been struggling with PCOS for years, you are not alone. Don't die in silence. Speak to your gynecologist. It can be managed effectively. Follow for more health tips on G's Health.